Okay, how you doing, people? Oh, nearly a schoolboy error there. I'll talk about it later. I'll talk about it later on. But anyway, welcome. It is 8 o'clock or 8:01, and you're listening to the Sports Therapy Association podcast. Or maybe you're joining us live, which is always a treat as well. We are now, hopefully you've seen some of the advertisements, we're now just exclusively going to YouTube. Okay, so no more Facebook, I'm afraid. It's all about YouTube. It's just easier. There's less connection issues. It's just much nicer. So that's what we'll be doing. Hopefully you have found your way here tonight. People have already come in the room, it would seem. If you do join us live, then what can happen is we can bring you up on the screen. All your comments can come up on the screen. So Gary Benson, founder of the STA. Hello, how you doing, Gary? Good to see you here. Leslie Campbell, hello, repeated O's. How you doing, Leslie? Good to see you. So it's actually a great way of networking, hanging out with other soft tissue therapists. You haven't got to be a member of the STA, obviously, to come here. Hey, Stephen Barr, how you doing? Thanks for joining us. But it gives you a nice little look at what a great bunch we are. Leslie Campbell has come back. 2 comments in 5 seconds. Glasgow in the house. Thank you, Leslie, for sharing that. And Catherine Reimer, nice to see you as well. So yeah, people are flocking in. Like I say, if you are listening to the recording on the podcast, and that's lovely of you, it would be even nicer if you could leave us a rating. That'd be great as well, especially on Apple. So if you're on an iPhone and you're listening to this, then please just click that kind of the 5th star along and maybe leave a rating saying great, something like that. It really helps just kind of get our message out and the message of our great guests out to a larger audience. So that would be fantastic. Lots of people coming tonight. YouTube is proving very, very popular. So where are we? We are in part 3 of our month's focus on women's health. This is what we're doing at the Sports Therapy Association. Every month we're picking a topic so we can focus on it and people can hear what's happening and then they can tune in. We started off, well, tonight actually, we'll go backwards. Tonight we've got 2, I can only describe them as friends of mine now. One of them I've never heard of before, never met before, but after the last 10 minutes, I feel like I've known all my life. It is, of course, the woman who will be appearing, thanks to Matt Scarsbrook. I asked Matt Scarsbrook, do you know any women apart from your wife? And he said, yes, I know one. And that's who's coming up later on. So we're really excited about that. And we're going to be basically looking at how much, in theory, it was about to highlight how much do male therapists need to know about women's health. We've had from some fantastic guests like Emma Brockwell and Graham Donnelly, and we had Jenny Burrell last week talking about menopause. And there was a lot of questions about male therapists when women come in. Is it an awkward conversation? Things you should really be asking so you could not necessarily treat them yourselves, but refer them to the right person. We've had episodes with, for example, Deborah Thurlow-Rowley talking about endometriosis, and we had hypermobility episode. And it's quite scary for those of you who haven't caught up with those episodes, how many women's health issues actually go diagnosed sometimes for up to 10 years because they just haven't been sent to the right person. Even GPs sometimes, we've heard, just send women away. And we'll be talking about later on. There's something about women's pain which is regarded less serious than men's pain. It's something we will get into. Thanks to Matt Scarsbrook joining us. Very excited. If you haven't seen what Matt Scarsbrook is up to or seen his latest videos, then we'll be chatting about that briefly. And also the women he's bringing along will obviously be very interesting as well, because women are interesting. Right. The next section will be looking at, what do we have? We're on YouTube. Obviously, you can download it on Apple or anything you like. Spotify seems to be very popular at the moment, and people are realizing we're on Spotify as well. If you missed out the first episode, that was with Dr. Fiona Higgs and Deborah Thurlow-Rowley, who have got their own thing happening now. I think they've maybe even recorded the first episode. They've started their own Women in Sports Therapy, aka WIST podcast, and it's a project very much addressing things which we brought up on the Sports Therapy Association podcast about role models. They'll be talking about women's health issues. They'll be talking about anything which could be of interest to the industry, not just for female therapists, but therapists of any gender who want to be aware of women's health in our industry. So check that out. Follow Dr. Fiona Higgs and Deborah Thurlow-Rowley. Listen to the episode with them, which, like I say, is available on all podcast players. Last week we had Jenny Burrell, which was all about the menopause. Fantastic episode with one of the leading educators in women's health. Very much suggest you check it out. Jenny is a fantastic educator. And again, it was an eye-opener for some of the things which we don't even think about. It was a topic which I'm sure we'll refer to later on tonight as well, because it's something, as Jenny said in her own words, you don't really think about. Even women don't think about it until it hits you. How many women out there have actually had a conversation with their mum with a cup of coffee saying, but mum, what is the menopause really like? most women I've talked to say when their mum had the menopause, they just ran out the door and avoided any form of communication. So that's something we'll be addressing tonight as well. And like I say, if you've joined us, then feel free to ask questions to our guests. I've got a funny feeling it's going to be a very good one. So without further ado, we'll get rid of that and bring up Mr. Matt Scarsbrook and a woman. I'm not going to get tired of saying that, honestly. Hey guys, how you doing?
Hello. I'm not going to get tired of hearing that either.
Let me just put your names up. There we go. So thank you for joining us. I'm very
thank you for having us.
No. Thank you for joining us. It's great. I'm in my mind, this is going to work so well. I think it's really nice.
You don't know us too, then.
But again, that was
also, we've heard about what happened in your mind when you were imagining this podcast, and so
no, this is going to be historical. This is going to absolutely go viral. I'm sure. I'm really confident. But anyway, so I need to change women. I need to change a woman. This is it was funny at the time, but it's not funny anymore. Let's call it a lady. No, not. Let's call it Katie. That'll do. Katie. There we go. Thanks for joining us, Katie.
Thank you for having me.
Obviously, you're not representing all the women in the world, but we are hoping that in the experience you have as a woman, that you'll be able to highlight some of the things which we talk about in our conversation. You're not a therapist at all, are you? Soft tissue therapist?
No, not a soft tissue therapist at all.
Which is kind of important as well, because we didn't want to have any bias at all, as in you knowing what we were kind of like thinking about. So have you ever received much kind of soft tissue therapy, massages or sports therapy or physio in your life?
Not in a sports way, mainly just the usual spa massages.
Okay,
but
that's fine.
Yeah, not in a sports way.
That's okay. Any differences?
I don't I was going to say, I think I used you for practice once and you never came back. I don't know what that's next.
It's very similar. It's just sports therapy basically breaks down soft tissue because it's deeper. That's basically the only difference, and improves the circulation even more because you're pushing harder. But I know Matt will go into that.
Matt Phillips.
Which leads us nicely onto Matt Scarsbrook's latest videos about those very topics. Matt, how are you?
I'm all right, thank you. Yes, I'm good, and I'm glad you asked, because although I've got stuttery video on this link,
I'll wait.
Seems okay at the moment.
Outside. There we
Talk
go.
to us about your latest videos. How are they going? What's the
yes, I've been playing with.
Been to we've had the massage one, which was the latest one, the massage guns.
Yeah, we had the massage guns ones doing pretty well at the moment. I think it's slightly longer, so it's YouTube's all about people watching to the end. Watch to the end. No, it's going particularly well. The one by far and away that's leading is still the 5 things your massage therapist wished you knew. But that's largely, I suppose, because of the wonderful community of people that listen to me blather on and they agree. So,
Yeah, that is always a bit of a problem. We've talked about this in the past, haven't they? Because there is this danger of an echo chamber. But have you had feedback? Personally, I am biased because I love the work you do. But are you getting any feedback from people who some of the information you're giving is actually a little bit new? And maybe it's been put in a way which is slightly humorous, but mixed in with research in a kind of approachable way, which is helping them?
I haven't had anyone reach out and say, "Hey, this is new. Tell me more." I have. I've had my first troll. I think you've made it on the internet when you get a troll. I think it should be a badge of honor.
Yeah.
And so that's been good fun. But other than that, no. So far the echo chamber is functioning perfectly well. It would be lovely if we can sort of branch outside that echo chamber, because I'd like to know what the rest of the world think of the crap that I'm producing, but I'm enjoying producing it. So
brilliant. It is something, it's tricky, isn't it? You say you've got a troll, but you are still presenting information which, as we know, kind of goes against the grain a little bit for people.
Yeah. Oh, absolutely. Yeah, no, it can be a bit tricky and a bit challenging, and I suppose with these videos I am attempting to deliver them with a sense of humor. Now, my sense of humor is definitely not everyone's cup of tea, and it's barely my wife's cup of tea at times. But I think humor helps, but I'm also not trying to make the video so. Yeah, I mean, you mentioned it earlier. I can go off off in the deep end with the detail if I really want to. But that's not what I'm trying to do here. I want to keep it fresh and simple, and for people to be able to just dive in and either use it to support, maybe with a client. That would be fabulous if people find it useful to explain stuff to clients, but also just to generally improve the understanding of these things. But my next one, I am aware that some people have kind of gone, yeah, this is great, but why is massage good? So that's the next video. The next video is going to be my love letter to massage, I suppose you would put it, but based on the evidence.
Very cool. Well, I do recommend, if you listen to the podcast, I think most of the people who join us live are aware of you, for better or for worse. But if you're listening to the podcast and you're not aware of Matt Scarsbrook and the work he does, then go over to his YouTube channel and check them out. And I do advise you to go, even if you're a little bit like, oh, I've been reading that I can't break down scar tissue with my elbows, or maybe I'm not improving circulation. So what am I doing then? Because we've talked about this loads of times. It is a stressful time when you are getting a little bit more evidence-based. And as we've said so many times on the show, it's not a case of you throwing everything you've done away. You haven't got to start suing your people who have trained you. It's just little delicate tweaks which ultimately will basically get you more thank yous and see more results. Okay, and that's why you're in the business. You're not in it for the money. We all know that. You're in it because I mean, it's obvious. No money. You're in it because you're one of these people in life who has the empathy and you want to care for fellow human beings, and you're prepared to rub your hands on them to do that. So you've already got the skills and you've got the dedication and the personality to be hugely successful. It's just little tweaks to change where you're putting your time and also putting your money, as you'll understand what I'm saying by that when you look at Matt's in-depth analysis of certain brands of massage gun. But anyway.
And thank you, Catherine, for pointing out. I've noticed you've been sharing my videos, and it gives me warm, fuzzy feelings, and I don't mean that. It's lovely, so thank you.
Warm, fuzzy feeling from Matt.
I love a warm, fuzzy feeling as well, Katie.
Right, okay, so there we go. So let's get on to tonight's topic then. So we had a little chat about how we're going to set it out. I mean, it's become quite clear that there is a lack of knowledge. Maybe not just, I mean, most blokes hand on heart would say, yeah, I don't really know much about the menstrual cycle. Sorry, and a lot of them probably wouldn't even care. It's just not their cup of tea, and if anything, they want to avoid it. And that's a problem when it comes to when pertainers of menstrual cycles come into your clinic and they're looking for help because they've got some kind of pain, because then you need to know a little bit about it. But it was interesting last week with Jenny that we discovered that when it comes to some topics, not just, but for example, menopause, that a lot of women don't know about it. So Katie, as we've just made you sit there and listen to banter between myself and Matt for the last 10 minutes, what about for you? I mean, you don't represent all of women, but how is the whole menopause kind of thing for you? Have you been exposed to it, or would you have known about it if you hadn't met people? Or?
So really interesting that you say, yeah, not many women know about it either. So I'd say I'm in that camp where I am a woman. It's been tested, and I have a lot of women friends and family. So for me, you'd think I'd know a lot about menopause, but I really don't, or didn't. So my mum went through it, and it was just a period of time that I didn't really understand her or what she was going through, and it never got spoken about, and it hasn't been spoken about since. So for me, it was just something that it's going to happen when I reach some sort of age, which I can't control, and I'm just going to have to ride the wave and go through it and hopefully get out the other side, still married to my husband. Whereas we've got a friend who I think we're allowed to mention, Matt.
Yes, yeah, she said that's all good.
Friend Gemma, who she's quite big into menopause. She's a nurse, and she's done a lot of research on menopause now, and her and I have had lots of conversations about it, and I've learned more from her about the menopause than anyone else, and it's just made me realize that we need to know about this stuff sooner, because Gemma basically her background is she was told to expect early perimenopause effectively, and she had to make life decisions based on that. But what's been incredibly valuable is the fact she's been so open, I think, with that, Kate, isn't it, to be fair? And the conversations that then, me as a partner, because, obviously my wife and Katie and all the girls chat,
but then the conversations that I can then have as a guy with my wife, having a conversation she would never have even thought about either. And, you know, you've involved Tom, and it, all of a sudden there are conversations occurring because someone who is unfortunately in that position where they have to know about it is happy to share it so that others can benefit. And I think that's fantastic.
Yeah, absolutely. And just the whole control factor of it as well. Like, again, as I was saying, it was always that thing that you just have to go through, like, and there's nothing you can do about it. Whereas with Gemma, that, like, she's told us there's so much you can try and do to manage your hormones and manage your mental health and your well-being, and that can all help towards it, which you're just not taught that as a woman. Even with the menstrual cycle, like, you're just expected to get on with it, I think, in society. Like, if you've got all the symptoms, which we could go into or not, but you're just expected to get on with it and just take some painkillers or take a hot water bottle and yeah, just get on with it. But I'm sure there's so much more you could do to try and manage it, like exercise and things like that, but we're just not taught that.
It's kind of weird you say that, and I think we were talking about this before, Matt. You mentioned, like, it seems at the moment the only introduction even a woman gets to women's health depends on how much your mum wants to talk about it, or if you've got a sister or a friend. There seems to be this big kind of element missing, which we thought was looking after us.
Yeah, absolutely.
Well, and I mean that bit, if we could sort of jump into this, because I think that for me, when I was looking at, you know, what can I add to this evening other than clearly bringing along Katie, it was well, let's just look at the history of why we're even here, right? Why do we even have to have a conversation that's labelled women's health? It's health, isn't it? and it comes back to this basis that the male has been assumed to be the norm, and anything that is not male is therefore atypical, which is slightly ironic considering I believe women outnumber men 49%, something like that. But it allegedly it goes back as far, well, it's recorded as far back as Aristotle, who basically decided that women were simply dysfunctional men, and the only difference being size and reproductive function. And basically Aristotle's view was that women were inferior because their bodies were not warm enough to produce semen. That's why male testicles were on the outside and female testicles were on the inside, because they is cold.
Wow.
In it. And when I say female testicles, I genuinely mean that, because the term ovaries wasn't actually introduced until the 1660s, when finally someone decided that perhaps they weren't in fact testicles. So this idea that the male is the norm. I mean, I'm just going to, for those who are live, I was just going to bring up these images quickly. How many people have images similar to this in their clinics? Yeah. What do you notice about these? What do you notice about these two individuals? Yeah.
Testicles on the outside.
The testicles are on the outside. And that is totally normal for everything anatomy based, right? There was a study done where they looked at American textbooks and across something like 16,000 anatomical images, male bodies were used 3 times as frequently as female bodies when describing anatomical parts, if you will, that were identical in both. So even when we're not talking reproduction, men are assumed to be the norm, and this seems to come through all of our education in everything, to the extent that, and you know, we'll jump back and forth on this, I'm sure, but to the extent that it even affects the way we conduct scientific research today, and that's both in terms of women in sport, which is obviously, you know, key to the, you know, this podcast and population, but also women and the medications that they take, and that obviously impacts, well, women's health across the board.
Yeah, great points. That's very true. So it's kind of not surprising that we are where we are today. And I'm sure shortly we'll ask whether we're managing, or whether it's managed to turn around a little bit. I'm interested, Katie, whether I've heard conversations from women who have been to see male clinicians, GPs, and even consultants, and they've just been a little bit shocked at the lack of knowledge they've had or the lack of consideration. It's a common theme. We were talking a bit off air in last year in March, and the government actually basically said what we're saying. The government kind of owned up. Hancock put his hand up and said, okay, I agree. The NHS is basically a system that was created by men for men, and we need to make a change. And they did this survey. I think they got 100,000 responses or something from women across the country in the UK, and were asked about their personal experiences with women's health, people in the family, so daughters, mothers, grandmothers, etc., and also their experiences at the hands of healthcare professionals in the UK. And the results that came back were pretty shocking. There was, I think, only 9% of the responses said that they felt they'd been informed by anybody about the menopause or given any information about it before it actually happened. 9% of all the women who went to see a GP. Yeah, it was like, it wasn't until they hit it that they said, oh yes, you've got the menopause. Here we go. Let's talk about it now.
Yeah.
But Katie, have you ever been felt a little bit let down by seeing a practitioner?
I'm lucky enough that I haven't, but mainly because I haven't needed to go and see a practitioner about anything like that. I'd say the closest I come to it was I went into hospital with stomach cramps and got asked by several people, oh, are you pregnant or is it your period? And you're just like, well, if I was pregnant, I probably wouldn't be in A&E talking about stomach cramps. I'd probably know. Yeah, and it was that, and the majority of them were men, and it's just that it's automatic, like, oh, let's get that question out of the way, and then like try and talk about something else. I've had friends who have gone to doctors with like hormonal imbalances, and they've been like depressed or anxious or crazy moods and stuff like that, and they've just been put on medication, antidepressant, without the doctor actually trying to establish whether it is premenopausal or not. And again, as we're talking with Gemma, I've sort of had these conversations with friends like, oh, have you ever thought that it could be to do with the menopause or to do with your menstrual cycle or to do with anything like that? And they're like, no, and the doctor didn't say anything. So like, you know, I've got a friend who is more clued up on any of this than half the doctors that myself or wider friends would speak to. So yeah, luckily I personally haven't had it, but again, we're not educated, so you trust the doctors and you trust the healthcare professionals to be able to do that. Like, why should we have to go and do our own research to then turn to a doctor and say, well, what if it's this? Why are we doing their jobs for them? It's crazy.
There's some really interesting stats around. So women are more at risk of being diagnosed with depression, and women by and large, I think more women are on antidepressants than men. Yet it is men who are more likely to seek help for mental health issues. So the question is, why are more women on the drugs? And it is supposed that although men are seeking help for mental health conditions, women are presenting with other conditions, and it's assumed it must be mental health. And so they get given antidepressants.
Yeah.
Which is yeah.
It is quite shocking. The more I've looked into it, especially since we started this women's health. I mean, it went back actually when we went back and we had that period of, no pun intended, but we had that period of kind of time with Emma Brockwell and Grenier, I think, came along, and we had male public health specialists as well. Bill Taylor came along and Gerard Green, and it was then really got my interest in it because I was as hands up the same as anybody else. I really wasn't aware enough of what that person coming in to see me could be suffering from and asking the right questions. But the more I looked into it, I realized that there is across society in the medical practice this kind of idea that women's pain just isn't kind of respected as much. It's almost like either one, they just tend to complain a bit more, you know, which is there. You know, they kind of like, oh, my lot, you don't understand me, no one appreciates me. And so the pain is kind of considered as different. And then two, like you say, Matt, it's like if they come in with something, it's like, oh, it's probably mental health, it's probably stress or something. They're not coping very well with their kind of like, you know, family duties and things, as opposed to looking at something like endometriosis, undiagnosed for maybe 10 years, hypermobility, same thing, could be undiagnosed for ages. Even simple pelvic health issues like you said before, Katie, having an excessive period with lots and lots of pain, you kind of thought, oh, I'm just unlucky. I'm one of those unlucky ones. I just have to put up with it and chuck some Feminax down my throat, like the adverts say, when really it could be the onset of something like endometriosis. So it is quite scary the more you look into it, the way that when it comes to health, this kind of gross ignorance we have about women.
Yeah, and I wonder whether that puts a lot of people going off to see their doctors because they just think, well, they're probably not going to be able to help me anyway, so why bother?
We've got
Which
some
is a
comments
dangerous
here.
situation.
Yeah, no, it's shocking, and that's across the population. And we've also on Run Chat Live on my other podcast, I talked to Tina Muir about athletic amenorrhea and that, and the fact that she'd seen GPs repeated number of times who basically said it's just normal. You're just exercising a lot. Don't worry about it. You can't do both things. You can't be an Olympic athlete and expect to have regular periods. It's one or the other, love. What do you want to do? That was what she was told by GPs who were looking after elite athletes. But there was an interesting comment here, and the coaches as well. Coaches are just as guilty when you get to sporting populations. The female athletes are made to feel guilty if they take time off, or they start questioning what's going on, or they're starting feeling like typically losing and not having periods. It was Affinity Bodyworks here, clinical soft tissue therapist Sarah Jones here. Hey Sarah, thanks for joining us live. Sarah Jones said, hi all. Did you know that GPs don't have any mandatory training in their degrees around peri-post menopause? It's an optional module. Only affects 50% of their patient list. Now, I don't know whether that's true or not, but if it is, obviously,
I would be tempted to trust Sarah on this. She's a bit of she's my local expert. So
there you go.
I'm going to trust her.
It's scary. No, I'm just putting that disclaimer in case, we're all brought up not to believe what we read.
Absolutely.
But if that's true, which we have no reason to doubt, that's that's incriminating, isn't it?
Yeah, I'd be so tempted to next time I go to the doctor just ask like, oh, so did you actually do the training about peri and post-menopause? No? Okay, well then I'd like to see another doctor who has, please.
Exactly. No. I opted for...
Just whilst you were touching on the sports side of things there, Matt, I don't know if you can just make, well, not me, but my image bigger, although I wonder if it's going to be the wrong way around. If people can see the little image of my screen, that's Stacey Sims. Yeah, it's the wrong way around, isn't it? So that's just an image from a TED Talk to go and get you guys to go off and listen to the TED Talk. So for those listening on the podcast, it's Stacey Sims and it's Women Are Not Small Men. As a TED Talk from 2019, and this was recommended actually by Gemma, our friend, and here she goes into, briefly like TED Talks do, but she goes into talking about how the differences between men and women show up in terms of sport and in terms of training, and how important it is to understand where you are in your menstrual cycle and how it impacts you, so that you can time your training so it is both most beneficial to you, but also so you can recover properly and be eating properly in order to achieve your goals. Because again, guess what? Actually, you mentioned this, Katie, didn't you? You say when you were talking, you were looking for training programs for you and Tom.
Yeah. So I put together a lot of our training programs for triathlons, running events, just keeping fit in general, not like sports athletes, but just I work well to a plan, and so I always just look on Google and sort of see different training plans and try to put together something that works for us based around our schedule. But I've never even thought about it from the point of view that I menstruate and Tom doesn't. So actually that's going to affect us differently. And there's probably is times when I've felt really unmotivated, fatigued, bloating, cramping, all that sort of stuff. And I've just got on with it because that's part of the track, that's part of the plan. And Tom's doing it as well, and you just sort of think, I look back and I think, why haven't I adapted it? Like that would have been such key information for me to be able to adapt my training plan to do that and to get more out of it as well. Like you were saying, Matt, in terms of doing your strength training at different times of the month versus cardio and stuff like that. It makes you feel better at the end of the day when you feel like you're winning and you're not just told to do a run on a Monday, but you're not really feeling up to it because you're feeling like crap and you've got cramps, but you have to go out and do it anyway.
Out of interest, this is something that I hadn't really thought of, and Helen is doing, but she doesn't have like an Apple Watch or anything. So Helen's my wife. Sorry, just this is the problem with it.
Tom's my husband.
This is the problem with just like chatting with someone you already know, and you sort of realise that actually everyone else listening is like, who's this third person? Have you found benefit in the sudden influx of things like apps or wearables for tracking cycles? Do you see that as beneficial, or is there kind of a lot of marketing in it? Does it help with your understanding of your own health?
for me, so I, without plugging in anyone, have Garmin, and I have their tracker on it. And the only thing it's useful for is predicting when it's going to turn up. If you're regular, if you're not, it could surprise you the day before, the day after, whatever. But it's pretty much just it could happen in and around this day. It doesn't provide me any information about how I should adapt my training and life. Yeah, it doesn't do any of that. It's pretty basic, and I haven't looked into apps that could do more.
Yeah. Oh no, fair enough. I was just intrigued actually, because it's hard to know sometimes whether these are just marketing spiels for some of these big companies or whether they are actually of any use.
Yeah.
One would hope that it's a little bit of both, because at least the conversation's occurring, right?
Yeah, but I think that link between exercise and periods probably not done enough, because even the popular ones like natural cycles and stuff, they're all about hormonal balance and really you trying to get to know your body and not use contraception, or not use drugs as contraception, but to use your own natural body. I haven't used it, but I would doubt, and I'd like to be proved wrong, that it talks about exercise and stuff within that as well as part of that. So I haven't seen much out there, and it's only through this conversation that I've started looking for it. And I just sort of think, why has it had to take for us to bring this up, to talk about women's health, for me to have to go out and find that information?
That's interesting. That was actually, I think it was Becky, actually last week had that. She just wrote in the comments, how come I never thought about the menopause until now? What is wrong with education? Things have got to change, and it is bizarre. I just got to say that Sarah's come back. I'm sorry I kind of doubted you, Sarah, but it's just our job. She says, lol, local expert going through perimenopause. I've had to learn much of what I know away from the GP and ended up paying privately. I was offered antidepressants too. And also that was backed up by Leslie as well. Leslie Campbell says antidepressants are so commonly prescribed for menopausal women. And then in true Leslie style, she follows that up with a comment, perimenopause is a bloody hormonal imbalance, not mental health, makes my piss boil. So
love you, Leslie.
Thanks, Leslie.
Is that symptom of menopause, or is that symptom
there you go. Assuming there's a metaphor there, or are we listening? It's very good. And then Sarah came back and said, connects to what we were talking there about, high-level athletes commonly have their cycle suppressed with the pill, so their training doesn't have to be periodized around their cycle. This is something which we'll talk about. I mean, next week, just to mention it now, we have got Emma Brockwell and Grania Donnelly, who I mentioned before, and their colleague whose name escapes me for a second, but they are responsible for, as well as publicizing the first ever postnatal running program, which until 3 years ago had never been even contemplated. There was no guidelines at all for it. Together with Tom Goom, they produced that. Now they've got their athletic female program, which again is helping to train athletes. They'll be in next week, and I'm sure we'll touch a lot on this for sport specific stuff. But again, it is quite shocking how, if women are just not told what to do, they're actually kind of conned and tricked, there's no other word for it, or used by probably male coaches to kind of like deliver fantastic results. And it's all a bit depressing. We need to move on to something a bit more exciting soon, or not exciting, but a bit more cheerful.
Oh no, let's move on to, well, I'll tell you what, so in case more cheerful, drug trials. I was drug trials, woohoo. I was so again, so cos geek, I thought, well, let's have a look at how the world of science influences what we do and don't get taught, I suppose, about women's health and how women are different from our standard male model. And actually, one of the books that I was listening to makes the point that the standard male model is a Caucasian 70 kilo male, and certainly even the 70 kilo bit doesn't particularly well describe most males, and so even the male model is screwed, let alone the fact that it doesn't encompass half the population. But there was some really interesting stuff around looking at whether women are included in clinical trials or not. So particularly we're talking drug trials. And there was I don't know if people remember, but the thalidomide babies, what's the word? Catastrophe. I suppose that happened in the late 60s or early 60s, I should say, where this drug thalidomide, that was a recognized sedative was given to women to help combat morning sickness on the basis that the researchers couldn't find a high enough dose to kill a rat. Now, if that doesn't make it safe for women, I don't know what does. And
so I thought you said this was going to be more cheerful, Matt.
Yeah.
Oh, this is definitely more. Well, I mean,
thalidomide, much. You keep going, mate. Thanks, mate.
Obviously, that all went horribly wrong. But the reaction by the FDA, so the Federal Drug and Food and Drug Association in the US, was to basically ban the use of women of childbearing capacity in drug trials.
Oh, because that makes sense, doesn't it?
Childbearing capacity, okay.
Yeah, because they just didn't want responsibility, I don't think, and that's basically continued. Now, since '97, the different areas of the world have started making it more mandatory that women are included in these trials, which is
how is it a trial if you're not including women?
Yeah.
Right?
Welcome to research. Yeah.
But what they have discovered since, and it's still not being done well. In fact, there's many reports of trials being funded by the FDA that are basically going, no, you're still not including women anywhere near the proportion that represents how they are affected by the condition that you are investigating. This is mental. But one of the bits that has come out of it, which I think is relevant to sports therapists and massage, any therapist that's basically doing a form of consultation, is that drugs, and this might sound completely obvious, but women are different. And
Whoa,
I know, right? And therefore the drugs that they take are processed differently. And so that can be as much as, it takes longer for their kidneys to filter out drugs so that active drug is in their system for longer. It can be that drugs that need to be taken after meals need to take longer for social Gary's basis up his small talk. I do apologize, Becky. This will get more exciting, I promise. The minute someone uses the word vagina, it'll all go down.
Yeah.
Sorry, Matt, I interrupted you with just a comment there for people listening to the podcast. Carry on.
But the fact that, okay, so I'll wrap it up. We now know that there are differences in the behaviors of drugs such as paracetamol, antidepressants, antihistamines, antibiotics between male and females, and in females depending on their cycle. Now, when was the last time anyone prescribed a female was prescribed a drug that accounted for where they were in their cycle and the fact that they're not a man? Equally, because all of the early research is not only done in males, but it's done in male animals as well, drugs don't get progressed if they don't show any signs of benefit in animals, right? So you do animal testing first, then you go small trials in humans, and you go mass trials in humans. If you don't see any benefit in animals, then you don't move it further, you move it forward. But 2016, a study demonstrated that female cells respond differently to certain drugs than male cells. And in this particular trial, the female cells, when exposed to the drug, actually fought off the virus that was being tested for, and the male cells didn't, which means we've discovered that there are drugs that work for women that don't work for men. But when we're only testing on men to begin with, those drugs are simply not making it through further down the trials.
Wow.
It's just like,
how is this allowed to happen?
I know. So anyway, that was upbeat. Quick, Katie, rescue me.
I'm just gonna shout vagina. Hopefully that helps.
I want to. I mean, no, that is amazing. It's quite shocking. We joke about it, but it's like, it just shows. I don't know. We won't get into the topic yet, but how we can change this. We'll save that for the end. But I want to involve the people listening here. Even if you're listening to the podcast, then maybe if you got a bit of paper and a pen, depends how geeky you are. I like to think all the people downloading this podcast are sitting there with their notebook and pen ready to take notes. Because don't forget, if you belong to the STA, then you can hand that over CPD and just write a little email or something to Gary Benson and say, I learned this from the podcast, and that'll be CPD. And it's free. It's a great way of doing it. But people in the room, guys, really, I know there's not I think there's probably about 5 or 6, 7 maybe guys in the room today.
Stevie, you're going to have to represent here tonight.
Yeah, there's a few of you there. I just want you to write down, it's got to be the first thing that comes into your head. Okay, so I'm going to say it out loud, and then you just type it in the comments. And if you're doing it at home, you can write down the first thing that comes into your head as well. Name a disease and health problem that solely or disproportionately affects women. Okay, I'll read it once more. Name one of the diseases, or name a disease, just one for the moment, or a health problem that solely or disproportionately affects women.
And while they're thinking about that, can I refer you back to your earlier comment of upbeat?
Well, this is a game show, isn't it? Doesn't matter what the content is. People are excited now. They're kind of like going into like, oh, I can get. It's competitive. You know? It's the what do we got? So do not me. Oh, Gary says do not email me. Fill in the CPD form, please. Okay, CPD form. Okay, so Stephen, now your name is on there. And Gary, what do you think is one of the most common diseases or health problems that solely or disproportionately affects women? What are you going to write down? Disease for women. We've got fibroids. Okay, I think Sarah Jones. I don't want to jump to any conclusions here. Endometriosis. Oh, you guys know too much. I mean, what I'm asking you from here. Hopefully at home, in my mind, everyone at home who downloads the podcast has written something down like, what do you think most people would say, Matt?
Well, so what I was going to suggest is, just to get people thinking as well, is to think of it as a non-female health specific disease. So not a disease that's going to affect the uterus, the breasts, or the female testicles.
As they will be called forever now. Breast cancer. Thank you, Gary, for representing the standard man, the bloke in the streets. Bless you, Gary. Thank you so much. 6'6", a standard bloke in it. Yes, breast cancer. And this is, I mean, I read that and it's used. I think if it was like, what's the name of that show? We asked 100 people in our survey, Family Fortunes, whatever it was. The top answer would be breast cancer, wouldn't it? And I think, although obviously it does affect an awful lot of women, it kind of masks as well. It kind of perpetuates this idea that, oh yeah, women, they only have to worry about breast cancer, or maybe some kind of cancer or something, or when in actual fact, and I was amazed to read this, is the biggest disease which affects women, like men, is actually cardiovascular, heart disease. And I know the people in the room aren't, because you're really kind of, you know your stuff. But I don't think a lot of the population realize that it is the biggest disease, cardiovascular. You kind of think that it's for guys who are stressing out of work and playing squash too hard in between. But in actual fact, it's a hugely high killer of women, tragically, despite what we may think. And it's interesting, which brings us as well, when you're talking, this is what reminded me, Matt, when we talk about differences between men and women, you were talking about on a cellular level. We're going to go slightly, turn the binoculars around the other way now. But even the symptoms for heart attack, we were talking about this off air, weren't we? Symptoms for heart attack are different between men and women. Anybody got any ideas in the comments here? Take a few moments to think. You listen to the podcast. How would you know if a man's having a podcast? How would you know if a man's having a heart attack? We kind of think about, don't we? Pain down the left arm, clutching, sense of doom. That
I was going to say that just reminds me of a terrible joke. How do you know a man's having a heart attack? Oh, don't worry, he'll tell you.
Good.
Now, strictly speaking, the original version of that joke was about vegans, but it works just as well.
That's very good. That's very good. Whereas if a woman's having a heart attack, I don't know how many people know this, but I found this very interesting.
But she won't tell you. She'll just get on with it.
She'll probably get on with it. She probably won't even know herself. That's the scary thing.
Yeah.
Because what are the symptoms? We were talking off air, Matt. What have you were privy to this, weren't you? What are the symptoms for typically?
Yeah, so typically the symptoms for females are fatigue, abdominal pain, shortness of breath, but rarely, so indigestion, abdominal pain, but rarely is it specifically chest pain and left arm pain.
Which is pretty crazy, isn't it? I mean, there's suggestions as to why this is to do with kind of, rather than being clumps of blocked arteries and things, it's kind of more evenly spread. But again, I don't think enough people know about that. We always think of signs of heart disease, look for clutching pain down the left arm, all this sort of stuff. And again, for 50% of the population.
But also, talking about those symptoms, they're like period symptoms, bloating.
Go home now, you're right. Just tell me, man, exactly. Deal with it.
How are you to know what's a heart attack versus?
Or if you turn up at A&E and you've got stomach cramps and they go, "Are you pregnant?" I'm dying.
Yes.
Jesus Christ. I mean, one of the bits that terrified me when I sort of looked into that a little bit more was, so you were just saying there, Matt, often you're looking for blockages, right? Arterial blockages in the heart muscle, because that's the assumed cause of heart attacks. But that doesn't seem to be the case in women. However, that is our standard measure of whether someone suffering a heart attack should then go on to receive high-level medical care, which is only delivered in the UK, at least in certain specific centres. But if you're scanning everyone and half the population don't have that as a symptom, by definition, they're not going to get that specialized care, because again, this model of care, this diagnostic tool we use is based on men, and the female conditions are different.
Massively so. I mean, how many of us have done first aid kind of for work or anything, or if you're a therapist, then you should be doing your first aid pretty regularly, or updates. I know it's only 3 years in theory, but that's not really enough, because you forget all about it and it changes so regularly. But hand on heart, I've probably done about 15, probably nearly 20 first aid courses and refreshers, and not once has anybody told me the symptoms for a woman having a heart attack, ever. It's always been the classic.
Scary,
you learn about the W position, and how to sit them. I don't know if that's different for women or men. It's probably the same, because it's got kind of physiological reasons for it, but never have I learned to look out for differences. Incredible, real mind blower.
I just totally misinterpreted what Leslie had written there about heart palpitations being mental through the menopause. For a lot of women, I interpreted that as heart palpitations are regarded as being mental because you're in the menopause. Yeah, it took me a moment to recall that, but it's absolutely mad. I think you've got some. You had another cool question as well, didn't you, Matt? I'm just trying to remember.
As in coming from the listeners here, or something?
As in coming from your list of random questions.
Well, I've got a few down here. I wasn't sure how this was going to go. You can tell I'm worried because I've got a bigger crib sheet. Nothing last week. Tonight, all pages. I don't know. Well, I mean, along the lines of differences between men and women?
No, I think it was along the lines of. Well, so it was ones where we were basically just going to get Katie to embarrass us, I think.
Okay, so we had some kind of stuff
asking
which
us
guys
some
might
questions.
not know about. Okay, we can move on
just to highlight the fact.
It's true, it is already kind of 10-2. So, okay, again, the idea was this is maybe, I mean, Matt and I might know a little bit more because we work, I know, but no, we shouldn't. There's a load of male therapists out there don't know stuff. I don't know. We knew we were going to be in the show, so we sorted up basically for the last week.
Yeah.
But other people want to kind of, we should ask Katie questions.
Yeah. Put the woman to shame.
Welcome to What Do Women Know About Women's Health? No.
Well, okay. So you say that. What do women know about women's health? I genuinely read an article on my Apple newsfeed the other day, which actually, here's a piece of advice, totally unsolicited, for guys out there. On your newsfeed, let's assume you're on a fruit-based device. On your newsfeed, subscribe to women's health type newsfeed articles, because then, without being embarrassed, you learn a hell of a lot about women's health.
Good point.
Because you start reading articles. So, for example, I was reading an article about a lady. She's based in the US. She was having severe issues with vaginismus and very sensitive skin around a vulva, which basically meant that she had never been able to have pain-free sex. And so she was seeking help for that. Mm-hmm. And the reason for the news article was because she'd ended up reaching out to effectively a prostitute, because essentially that was the only person who was willing to take her as a woman through what it means to achieve pleasure as a woman. And the article goes into how this poor lady had no idea that her clitoris and her clitoral hood were two separate structures, and how to identify one from the other. And again, if women don't know this stuff, then guys, we've got to do an awful lot better to make conversations like that completely normal. And so, unsolicited advice, sign up to women's health type streams on your news feeds. Very, very useful.
But I wonder how many
goes into the show notes.
Want to learn about that stuff. I mean, you guys, you're doing a podcast. That's good reason. I'm sure a lot of the audience probably will as well. But how many guys out there probably don't even think they need to or want to learn about it? And to be fair, women as well. I don't want to cast that on men, but yeah, how many women just
Until it's
breeze
too
through
late.
life? Yeah, exactly.
I think when you get a true idea, and again, sadly, people don't think it's ever going to happen to you, but when we look at the statistics, for example, endometriosis is very hot at the moment in the sense that it affects a huge amount of women that don't even know that they're getting it. We've talked to Deborah Thurlow-Rowley a lot about this, but yeah, until it happens to you, you don't worry about it, do you? But with women's health, and again, not to bring it down or anything, but women do have, I can't remember what the percentage was, it was in the study, the amount of, I think it was something like a quarter of their life women go through some kind of disability or dis-ease due to bad health compared to men, which is a fifth of their life. And I was looking at the potential reasons for this, because also, like Matt sort of alluded to earlier on, women do report these things kind of less. They think they have to put up with it more, and they kind of like just deal with it. I think it's just something to put up with. But and also you mentioned clinical depression. Women will suffer more than men, and anxiety. Obviously, we've got things like anorexia and binge eating, suffered more by women. There's so many potential flaws for women to find themselves in if they don't catch it early enough by communicating, do they? Which brings me, Katie. So, for example, you've got a friend who is educating you about menopause because she found herself in a situation which needs to know about it. What about other topics like? Is it a kind of generalization that women always talk about these things, or is it only if one of them's actually suffered from it and then it becomes a topic?
I'd say only if people have suffered from it, then it becomes a topic. Yeah, I really would. I wouldn't say, women talk about a lot of stuff and a lot of personal and intimate stuff, but it's usually based around their own experiences. I'd say.
So is that something needs to change, do you think, for the bigger problem?
I think it should. And actually, I'd say our friends more than most probably do like to do more research and think about their well-being and their bodies and look inwards. But even that,
that's largely because our friends spend half their time naked. like literally, I have never met a group of more body positive people. You know who I'm talking about. They spend their time basically naked. So I mean that helps in the conversation.
But I think we could all do more to learn about ourselves before we need to. Definitely, including myself. So
I guess the conversation needs to come from earlier on. We need to be introduced to it. I obviously haven't been in a sex education class for decades now. I don't know how much goes into. If anything, I think I heard it was being kind of diluted down and withdrawn a little bit according to current trends. But as anyone, I haven't got children that old yet. I don't know what it's like.
I mean, my children are only nursery age, but I mean, even my wife and I have made the decision that we're going to use anatomically correct terminology from day one. So my daughter is well aware she has a vulva, and will talk about it. If she's got nappy rash or whatever, she will use the word vulva to describe where she feels uncomfortable. What I find on one hand funny and on the other hand highly frustrating is that her nursery teachers won't use that terminology. They'll use the classic kind of fluffy type words in order to avoid calling it what it is.
And is that because they're embarrassed, or?
I'll be honest, I haven't actually taken them on directly over it. But it's sort of conversations. Well, it's sort of conversations at the nursery door. Or it's like, oh, she was a little bit red on her foo-foo, so we just put some cream on her. So, oh, for goodness sake, I held myself. For goodness sake, it's a vulva. She's told you that. Call it what it is. You've got one. No, I haven't.
Maybe don't go around pointing out people's vulvas.
All right, that's what Rowan does instead.
This would address it, though, wouldn't it? And probably
the education piece is very important. Though I can't believe that they've taken it out or they're diluting it down, because that's only going to make the situation worse. When boys are giggling about periods in school and girls are too embarrassed to talk about it, because that is what society is telling us, even in schools, let alone when you get into the old wider world. Workplaces, how often do we spend time at work yet you're not meant to talk about your period, or you're not allowed to talk about your period, or you got to hide your tampons and stuff in a little bag in the drawer, and if you're feeling rubbish, you can't just be like, oh, I'm on my period, I'm bloated, I'm grouchy, I'm this, I'm that, leave me alone. It's just not really the done thing, unless in some workplaces, I guess it is. I worked in an office previously with like 6 or 7 other women, and that was only the topic of conversation. And around the same time every month, it got a little bit crazy in the office. But I'd say in most offices, it's not really spoken about, and it's not really. Yeah.
And if people do start talking about it, then they kind of get, I mean, they almost get kind of turned into some kind of Joe Brand in the 80s figure where you're just saying it for attention kind of thing, and you're kind of ostracized, aren't you? Like, oh, you're just trying to, you'll get labeled a feminist or something, or you're just trying to talk about it when you don't need to. But it definitely seems to be the source of the problem. That's where it's like everything, isn't it? Start at a younger age. That's very commendable to you, Matt. That's really cool. It didn't happen to Catherine. Apparently, Catherine's just shared here. I still call mine Twinkle. Thanks, Catherine.
Hi, Twinkle.
Hi, Twinkle. How are you? Let's have a look. Sarah has come back. Sarah Jones from Affinity Bodyworks. They get taught in year 6, but I'd already told my kids the mechanics by then. It does continue through secondary school, plus education around Meno was introduced in September last year. Now, is that across the syllabus, across the country, or does that depend on which school you go to? I wonder whether it's I
mean, I remember the sex ed I remember back in year 6, it must have been. I think we were all in class to watch the best contraceptive video ever, which is basically watching someone give birth when you are 11 years old. That is a hell of a contraceptive. And then all the girls in the class were just kind of taken to another room, and we were told, and all the lads were told they were having a conversation. And then they come back in, and all the girls have kind of got, little packets with them, but heads are down, no conversation, and life moves on. And, at that point, it's like, of course, guys had no idea what periods were, because we were A, excluded, and B, not even given like the guy version of that conversation, which is mental. So I don't know if that still happens, but
we're not setting you up for success, are we?
No, you really aren't. It's all your fault. No, hang on, that sounds wrong.
Do you know who your teachers were, Matt? Were they male teachers? Do you remember who took you for that, or?
No, it was a predominantly female teacher school.
Was it?
Actually.
Interesting. Okay.
But again, I'm not a spring chicken anymore.
It was the 1920s. Yeah. Slightly. How can we? Obviously, this podcast and this show is seeing whether all this relates to soft tissue therapists, a sports therapist, massage therapists, and we've already discovered that we can make a huge difference, because we're not just women, but people in pain often come to us as the first port of call, because naturally it's almost like instinct. A rub makes us feel better. We have that from birth, don't we? Just that kind of contact. It is social grooming. Come on now, guys. You've done so well up to now. This is almost going onto YouTube with a suitable for children video. It's fine so far. So yeah, that social grooming, as Diane Jacobs would kind of make it, the power of touch, that contact, it's healing. It's a basis for healing in the very beginning. So people do tend to come to us for that back massage if they've got symptoms. So we have got this huge, beautiful responsibility to help people by asking the right questions, and then being a really important part of the chain of healthcare, and sending them to the right person, and turning 10 years of not knowing into maybe 6 months, and then suddenly realizing I've got to change my diet, I've got to do this, or whatever it is, or I can talk to people about it and get some kind of counseling, whatever it is. So it is exciting for soft tissue therapists. I guess it all boils down to just practicing the language and the questions a few times, and then having the confidence, and then installing that confidence to people who come to see us, really, isn't it? And sowing that seed, again, no pun intended, but sowing the seed that we can talk about this. It's natural. We shouldn't feel bashful. Maybe even saying, talk about your partner with this, or is that something that do you think, or Katie, we could do?
Thing with like the confidence of your patients as well. I know for me, even through these conversations, like you just got to ask all those questions. We shouldn't. As much as we'd like to rely on the healthcare professionals, we can't at this stage. So I think don't be afraid. Go and ask the questions. If they're prescribing you drugs, ask, is this suitable for me at my time of the month? Has it been tested on women? Like, ask those hard-hitting questions and challenge it, really.
We do have to. I don't like putting down GPs, because I know some fantastic GPs, but when I hear, like, for example, my wife coming back from an examination and the doctors asked her about her front body. My wife is like 35. Yeah. And she was just came back going, I'm not quite sure how I feel about this. He asked about my front body. Forget Twinkle. I prefer Twinkle.
Are you sure he was a real doctor?
Yeah, well, he had a white coat. But I mean, that is all obviously an N equals 1. But we've had comments from other people who visited GPs, and sadly we've had Sarah Jones who's kind of quoted that what they learn is not enough to cater for 50% of the population. So don't bad mouth another profession ever, because that doesn't do you any favors
And
at
it's
all. But
almost
ask the
not-
questions.
Yeah, it's not to excuse them, but is it their fault when society is bringing them up like that? Then that they're just learning a syllabus or a curriculum that they're taught to. So
Definitely.
I think it's probably also just reflecting from the therapist perspective. Stevie's just put in a comment that if we're interested in our client's health, we shouldn't be afraid to ask any relevant questions of their overall health. And I entirely agree. But I think probably given this lack of knowledge and understanding and lack of conversation that currently exists, I think the bit we've got to be really careful of, particularly as male therapists, is to highlight the relevance of the questions we're asking, because otherwise we run the risk of making our female clients very uncomfortable very quickly. I can't remember who I was talking to the other day. I was on a call anyway, and we were talking about this in the context of cauda equina type symptoms, and how sometimes people feel. So Katie, appreciate essentially you can end up with bowel and bladder problems, sexual function problems, numbness in the saddle region with this particular condition. And you've got to be able to ask those questions. And it can feel awkward the first time you do it when you're asking someone, does it feel different when you wipe? But in this particular instance, this is a literally life-changing condition that we need to identify very quickly. Most people would put it into context to say, I need to know, based on your symptoms, can you tell me X, Y, and Z? I think if we just suddenly start diving into our female clients' menstrual cycle stage, they might be sat there and going, what are you doing?
Has this guy suddenly picked up a new fetish?
Exactly. So I agree with Stevie 100%. I think the key word in there is relevance, making it relevant to our clients. Yeah,
great advice. And there's always, the pendulum always swings too far the other way. We've done it with pain science to a certain degree. There's therapists now are kind of jumping too much onto kind of just the psychosocial factors and beginning to downplay the bio side of it. But this is kind of part of the way of learning, isn't it? We go too far the other way, then find the right place. So great advice. To finish off then, I know the people in this room all know too much. I'm not going to bother doing that. No, you've ruined it, people, listeners. You know too much. Bloody echo chambers, eh? I'm not
Stevie, our token bloke.
Yeah, I had so many things lined up. I was going to ask about, how long can a tampon be up there before it becomes an emergency?
But up there.
Come on, Matt. What
Sorry, up your twinkle. About? Sorry, up your twinkle. How long can you have a tampon up your twinkle or your front body before it becomes regarded as an emergency? Could you write that down just to humour me? What are we talking? Minutes, days, hours? How long's the safe?
Go on, Stevie.
Stevie, on the spot. And then Gary. Please, Gary. How long?
And how many can you fit up there before it's unsafe? I'd like.
Oh, good Lord! That reminds me of.
And that's all we've got evening for tonight. Thank you very much for joining us.
That reminds me of a time. There is a fabulous book that is totally irrelevant to this, but has some overlap, called Bonk, and it's the secret. It's something like the Secret Science of Sex. It's by Mary someone or other, and my memory's failing me. It's period once now, Matt. Keep up. What?
I'm not sure she's replying to.
I have no idea who Leslie's replying to now. But this book, Bonk, anyway, it looks at sex from a scientific perspective and the developments of it. And talking of things up there, it does remind me of a story where a gentleman attended A&E with 2 pairs of tweezers up his urethra. And when asked why he had 2 pairs of tweezers up his urethra, his answer was, well, I lost the first pair, so I used a second to try and retrieve it and lost them as well.
Which is,
So, apologies on that note.
What a great note to finish on.
What a great way to end the show.
It's a good book, though. There's some brilliant books.
And I'm clenching, and I can't stop clenching. Yes. Well, there we go.
Oh, there we go. Stevie's answered. Not a clue.
Which is a self-support show. Oh, finally, the people who join us live every week have not got the answer. What would you say, Matt? Oh, do you know? How long before you start going to consult a medical professional? Before you get worried.
Believe, because again, I have actually sat down and read the instruction leaflet in my wife's boxes of tampons.
Of course you have.
Whilst you're trying to get the tweezers out of your urethra, yeah.
Whilst I was trying to get tweezers, I was like, what can I use? I believe it's 8 hours, otherwise you end up running the risk of toxic shock syndrome.
Spot on. You read those instructions wisely. Yeah.
Well done.
Yeah, 8 hours indeed. Yeah, 8 hours, Steve, just in case. I've no idea about the tweezers. Don't try it at home, basically. I think that's probably the message. Right.
And Becky has revoked her whatever was left of her outstanding invite to parties for me.
Okay, right. Well, look, it is 9:07. So Becky is coming now at 8 hours. Steve was at 4 hours. Halfway,
and
Steve.
Leslie was talking about period pants, not period wants.
Oh, period.
Oh, period one. I am with you.
Autocorrect.
They really lost the trail there. But Catherine Reimer apparently sticks a panty on a twinkle for 2 to 4 hours. Okay, thank you for that. Right, we've learned a lot about each other and our audience tonight. We hope that's been useful to you. Obviously, we've had a little bit of a laugh, or quite a lot of a laugh. But yeah, there's a message out there, basically, and it goes further, doesn't it, than soft tissue therapy? It's just a whole society thing. And of course, we're talking about the UK. In other countries, we recognise that the situation is thousands of times worse, where women are locked into rooms, in rooms during the menstrual period, or they have to use sticks and leaves or anything, and kind of disgraced to look after themselves. So yeah, we're relatively, compared to that, obviously we're fantastically well off in this country, but it's all relative, and obviously there's a lot of education that needs to be doing. But we can make a start, I think, at making a difference in clinic again by being that fantastic little chess piece. I'm going to try and continue a chess analogy now, but it's rapidly going to go off. But yeah, we are not just a pawn. Well, I like to think of ourselves as a bishop who can move diagonally to help patients get to that other area quickly. But yeah, it's an important message. And we will be continuing women's health next week, focusing specifically on the female athlete, where a lot of these topics will come up again. So if you've enjoyed listening to this, if you listen to the podcast, and hopefully you've still got about 5 days, if you want to join us live, we will be joined by Emma Brockwell, Gronya Donnelly, and Dr. Helen McElroy. Sorry, Helen, I forgot about your name if you are checking this out. So that we'll be joined by the 3 of them next week. Very exciting, because they will be giving details about, talking about education, about the female athletic female course, which they've put together. Again, taking research and putting it onto the clinician's floor, where you can actually learn from 3 of the best in the industry. Just before we finish, I love what Becky says. Becky's always got something good to say. Becky, thanks, guys. Matt S. That's good, Becky. Well done. Can you pop a link to your findings about men and women in medical trials, please? Fascinating. We'll make sure that goes into the show notes.
Yeah, well, I'm just going to bring it up on my screen very quickly. Not that bit. Come on. Why is it not refreshed? Now it's refreshed. And it's backwards again. Right, this book, for anyone who's interested, read it backwards. It's called Invisible Women, by Caroline Cradio Perez. I apologize, Caroline, if I've mispronounced your name. This is a phenomenal book, which basically just looks at how the entirety of society is designed for men. Everything from your ergonomic chairs to the heating requirements in office blocks are all based on the norms for men, which is why anyone who's ever worked in an office will often find the men in shirt sleeves and the women in cardigans.
So true. So true.
So much there. Right, we'll make sure that all of these useful links get put in the show notes. If you're looking for the show notes, the best place to go is either Podbean, who hosts us. You'll find them all there, but also even easier than that is go to the Sports Therapy Association website page, where I copy all of the show notes out again for your reading, pleasure and education. And that website is the STA, so thesta.co.uk. If you want information about anything we've talked about tonight, then have a look there, as well as links to both of our guests. I don't know what link I'm going to give you, Katie. Just phone.
I think we're going to rapidly create an app called Ask Katie, and it's going to be like an anonymous
Ask Jeeves, but
it's going to be an anonymous blokes can ask Katie anything kind of thing.
That is a good
we talked off air. You don't have a blog at the moment, but it's coming. It's coming. So ask.daily.com. I'll check if it's available now, but yeah, look out for that. But obviously, Matt Scarsbrook will put links if you want to follow him and check out the videos. Again, Matt, congratulations on the videos. I think they're amazing, and they're playing a significant part in helping educate our industry. We'll see you next week. If you want to join us live, it's always on a Tuesday at 8 o'clock UK time. But obviously, if you prefer listening at your own time, that's great. Just do leave a little rating on Apple Podcasts in particular. That'd be fantastic as well. So thanks once again to Matt Scarsbrook and Katie.
Thank you for having us. Really enjoyed being here tonight, so thank you
for representing the vaginas of the world. My
mission in life complete.
Tick that off your list.
The vaginas salute you both too.
Captain Mimer's got to have the last. Captain Mimer signing out. Me and my twinkle say thank you. It was a great discussion. And on that note, goodbye and take care of each other.
Bye.